So, good day everyone. I am here to tackle about the thyroid cancer. So, let's start. Thyroid cancer is the cancer that occurs when cells in your thyroid undergoes genetic changes, or what we call mutations. These mutations allow the cells to grow and multiply rapidly. These cells also lose the ability to die as normal cells would. The accumulating abnormal thyroid cells form a tumor. These abnormal cells can invade nearby tissues and can spread or metastasize to other body parts. There are 4 types of thyroid cancer. First is the papillary thyroid cancer. The most common form of thyroid cancer is the papillary thyroid cancer that arises from follicular cells, which produce and store thyroid hormones. Second one is the follicular thyroid cancer that also arises from follicular cells of the thyroid. It usually affects people older than 50 years of age. Third is the anaplastic thyroid cancer. This cancer is a rare type of thyroid cancer that begins in the follicular cells. It grows rapidly and is very difficult to treat. The fourth and last type of thyroid cancer is the medullary thyroid cancer. This cancer begins in the thyroid cells called the C cells, which produces the hormone calcitonin. Elevated levels of calcitonin in the blood can indicate medullary thyroid cancer at a very early stage. In addition, calcitonin is a hormone that is produced by the parafollicular cells of the thyroid gland, helping to regulate levels of calcium and phosphate in the blood. Next are the risk factors of the thyroid cancer. Female sex thyroid cancer occurs more often in women than in men. Second is exposure to high levels of radiation. The radiation therapy treatments to the head and neck increases the risk of having thyroid cancer. Certain inherited genetic syndromes. These genetic syndromes can increase the risk of having thyroid cancer. That includes familial medullary thyroid cancer, multiple endocrine neoplasia, and Cowden syndrome, and familial adenomatous polyposis. Next is the pathophysiology of the cancer. The exogenous and endogenous factors can damage the DNA, thus this results to epigenetic alteration. When we say epigenetic alteration, there is a change in the chemical structures of the DNA. Then the DNA is unable or is having a deficiency in repairing. That would lead a large increase in unrepaired DNA damage. Next is this large increase can also affect the somatic mutations and epigenetic alterations. And in this case, it will multiply the altered field defect with a driver mutations, thus progresses to developing a cancer. Next is the laboratory and diagnostic test in order to help diagnose or determine if the patient has a thyroid cancer. The ultrasound. These can help determine if a thyroid nodule is solid or filled with fluid. This also helps in determining the location and the size of the thyroid nodules as well. Next is the radioiodine scans. Chest x-rays, the CT scan, MRI scan, positron emission tomography, or what we call as PET scan, biopsy, and blood test. Surgical treatments for thyroid cancer is thyroidectomy. This is an operation to remove a thyroid gland that might involve removing all of the thyroid tissue. Next is removing a portion of the thyroid, or thyroid lobectomy. And the last one is removing lymph nodes in the neck, or what we call as lymph node dissection. Next is the postoperative treatment. First one is the thyroid hormone therapy. After thyroidectomy, the patient may take thyroid hormone medication, levothyroxine, for life. This medication has two benefits. It supplies the missing hormone of your thyroid that would normally produce, and it suppresses the production of thyroid stimulating hormone, the TSH, from the pituitary gland. High TSH levels could convincingly stimulate any remaining cancer cells to grow. Next is the radioactive iodine treatment. Uses a large dose of a form of iodine that's radioactive. The radioactive iodine treatment is often used after thyroidectomy to destroy any remaining healthy thyroid tissues, as well as microscopic areas of thyroid cancer that weren't removed during the surgery. This treatment may also be used to treat thyroid cancer that recurs after the treatment or that spreads to other areas of the body. This radioactive iodine is taken up primarily by the thyroid cells and thyroid cancer cells, so there's a low risk in harming the other cells in your body. And thank you for listening.